Welcome to the talk, The Hope Campaign, Hodgkin Awareness. So, I am Dr. Priya Murthy. I will be moderating the session for ETHealthworld. This talk is being presented by ETHealthworld and I am moderating the session. Lymphoma is a very common blood cancer that can affect the immune system. It is very easy to miss some of the symptoms, and many patients end up living for years together ignoring the symptoms. And at the same time, there are very subtle symptoms which, if you attend to, can help you in the diagnosis of lymphoma. Lymphoma not only affects the production of red blood, the blood cells in the body, but it also puts you at a risk for other cancers. So, lymphoma is of two types, Hodgkin's and non-Hodgkin's. In today's session, we will be talking about Hodgkin's disease or Hodgkin's lymphoma. And for that, we have three eminent clinicians from various parts of the country who are renowned oncologists and hematologists working in very reputed organization. And together, we intend to create awareness for the course of the disease of Hodgkin's disease, how the disease can be tackled, how it can be treated, and how you can afford to have a good lifestyle even after the disease is diagnosed. So let me introduce the speakers to you. Dr. Dinesh Pandharkar is the Director, Medical Oncology, Hemato-Oncology and Bone Marrow Transplantation, Sarvodaya Cancer Institute, Faridabad, Haryana. Dr. Ajay Gogya is an additional professor in the Department of Medical Oncology at Dr. BRA Institute, Rotary Cancer Hospital, All India Institute of Medical Sciences, New Delhi. And Dr. Jatin Saran is the head of the department and director medical oncology, Livasa Hospital, Mohali, Chandigarh. Without much ado, let's get on with the discussion. My first question is to Dr. Dinesh Pendharkar. Could you tell us what is a lymphoma?
So lymphoma in general terms is a disease involving lymph nodes. So every individual has a part of the blood system generally called lymph nodes. These are small nodes situated all across the body, which serve as a defense for that particular area. So we got nodes in the neck area, which would control this area as a defense, or in the axilla, or in the groin, or in the abdomen. So basically, lymph nodes are normal structures in the body, which are located at various parts of the body, and their basic function is defense. So whenever we get infection, a lot of us, we know that whenever we get tonsil enlarged or we get infection in the tooth, the first symptom which comes is the people will come say, my nodes are involved, my neck nodes are involved. Why? Because the infection in the tooth or infection in the tonsil is controlled by these nodes in the neck. They are the first line of defense. So lymph nodes are a normal structure in the body. They are there. Sometimes a disease in them, a cancerous development happens in them, which is known as Hodgkin's lymphoma.
Okay. Dr. Ajay, since we are talking about Hodgkin's lymphoma, are there any specific symptoms which help the patient to seek medical help, and are there any specific symptoms specific to Hodgkin's lymphoma?
Ma'am, which as Dr. Pandharkar said, is the cancer of a malignancy of lymph node. So specifically, this cancer is present with lymphadenopathy only. And the typical in the age group of in between 20 to 30 years, we have a long database in our institute, which is the median age is around 21 years, ranging from 18 to 31 is the median. Median age is 21, but the range is in between 18 to 31. So it is a malignancy of young adolescents to adult. So most common, the age is very important. And second is painless lymphadenopathy, mostly in the cervical area. Again, in the database, again showed is supraclavicular or cervical lymphadenopathy in 50% of the cases is presenting symptoms of lymphoma, especially Hodgkin's lymphoma. So it's a painless lymphadenopathy in the specific age group. Number two is the fever is fever in the form of B symptoms like fever, drenching night sweats, and weight loss. And these three B symptoms are characteristics. Again, it is again from our database is around 50% of the Hodgkin's lymphoma present with the B symptom, like weight loss is a kind of more than 10 kg or 10% in last 6 months. Fever more than 38.6 Celsius without any reasons, and drenching night sweats. Drenching means profuse night sweating in the night. So these two is the main symptoms. And rest in initially 80s, 90s, at the time of history of Hodgkin's lymphoma evolving, some physicians said itching is the B symptoms of Hodgkin's lymphoma, but currently there is no guideline or any any guideline or any expert shows that itching is the itching or pruritus is a kind of B symptoms in Hodgkin's lymphoma. So only this painless lymphadenopathy in the specific age group along with B symptoms is two main characteristics of these lymphomas.
So, Dr. Jatin, so if patients come to you with lymph node enlargement and whatever the B symptoms Dr. Ajay has just described, are there a series of tests that you will run, or what are the steps that you will take to diagnose that it is a case of Hodgkin's disease?
The first and foremost test I would do is I would go for a biopsy, and specifically excisional biopsy, or remove the whole lymph node and go for further test on the biopsy, which we call IHC or immunohistochemistry, to confirm the diagnosis of Hodgkin's lymphoma, what is the type of Hodgkin's lymphoma. So these two parameters are very important for accurate diagnosis of the disease, because the treatment of various lymphomas is different. So first is that. Then we will go ahead and stage the disease. For staging, we do some radiologic investigation. Initially, about some years back, it was CT scans of the whole body, like neck, chest, and abdomen. And we used to stage the disease, that where all the lymph nodes are present, whether it is present in the neck, or whether it is present in the chest, or whether it is present in the abdomen. These days, we have the availability of functional imaging also. That is, we can even detect whether these lymph nodes are actually an active lymph node, or it is something else. So that is called a PET-CT scan. So PET-CT scan has now become the basic test for staging our disease. So first and foremost, the biopsy, and second is the PET-CT scan to stage the disease. And then we go for blood investigation. Uh, we go for complete blood count. We go for metabolic panel, like kidney function, liver function, electrolytes. We go for viral marker testing, whether patient is already infected with HIV, hepatitis B, or hepatitis C. And we go for functional status of the patient in the terms of we go for echocardiogram, we go for pulmonary function tests, because there are certain drugs which and of Hodgkin's lymphoma, which we cannot utilize if these functions are not optimal. So we assess the functional status of the patient. And finally, we go for the risk stratification based on all these investigations before we plan out the treatment. There'll be further more points. I think we'll discuss further in the panel.
Dr. Dinesh, how do you diagnose Hodgkin's lymphoma? Are all cases with lymphadenopathy and fever, are all of them Hodgkin's, and how do you differentiate between other conditions which cause similar symptoms?
The only way to diagnose cancer is by doing a biopsy. A biopsy means removal of the tissue, either part of the lymph node, preferably whole lymph node. Because whenever a lymph node is taken out, we really want to see its structure, we want to do special tests like immunohistochemistry or some more tests to prove that this is Hodgkin's lymphoma or Hodgkin's disease. So the first and foremost for diagnosis is a biopsy. So my humble request to all the patients and everybody, whenever you are advised a biopsy of a enlarged lymph node, please do not shy away. Do not go away from biopsy. No doctor will be able to start any kind of treatment. He will not be able to go next step, even any investigation, unless we have this report in hand. So the first and foremost is biopsy. All patients should undergo a biopsy. And then a battery of investigation, as Dr. Sareen has suggested, we will have to inspect practically every organ of the body, because the drugs which we are likely to use may have side effect on those organs, particularly lung, kidney. So we would like to see how are they functioning before we push in the drugs. If we want to do radiation, we want to see how the organs are functioning, how much radiation can I give. So basically, once we have diagnosed the patient, we know that this is lymphoma, then our second stage is knowing where all it is sitting, which is done by either CT scans or a PET scan. Once we know, so I know the diagnosis, I know where all it is spread. And my third thing is I know how the body is. So once these three parameters are there, I can then put the patient into different groups. Is it a very small disease? Is it slightly advanced disease? Is it very advanced disease? Because the treatment, depending on the location, size, in medical terminology, we call it a stage, may differ. So the first and foremost is proving that it is disease, proving where all the disease is spread, how the body's fitness level is, making complete, as we call, staging of the disease, where all the disease is, and then planning the treatment. So basically, it's not a tough job, just takes 3 days, but this is all is a must before we take off on the next journey.
Yeah. So the word cancer itself, it's so scary. Dr. Ajay, could you tell the audience and how do we prevent cancers, and especially how do we prevent Hodgkin's disease?
Basically, there is no screening guidelines or no any test which prevent the Hodgkin's lymphoma, because in Hodgkin lymphoma, most of the time is associated with Epstein-Barr virus infection, which we cannot detect by either we can detect by serology, but by serology we cannot predict this patient is developed or this subject is developed Hodgkin's lymphoma or any other EBV associated malignancy like all others like nasopharyngeal and other cancers. So there is no screening guideline till date. There is no test to prevent this Hodgkin lymphoma till date.
Yeah. Dr. Jatin, so when a patient is diagnosed with Hodgkin's disease, the first and foremost he will be asking us is, how long do I have to take treatment? Will I survive? Is there treatment for this? So what according to you, how do you rate the prognosis for Hodgkin's disease?
So, whenever a patient who is being diagnosed with Hodgkin's lymphoma or Hodgkin's disease, first of all, we tell them that you are suffering from one of the most curable cancer. So we do prognosticate, risk stratify the case by, say, age, gender, uh, stage, and various other parameters, blood parameters like blood counts and all. But despite all that, even in stage 4, Hodgkin's disease is one of the most curable disease, and it is the Hodgkin's lymphoma in which, these days, or it has been a endeavor in most of the group Hodgkin's lymphoma treating groups, to de-escalate the treatment as far as possible. So that we give the most appropriate treatment. And since patient is having a long life, so we have to take care of the quality of life of patient and this should not be a short-term thing. It should be a long-term thing because it is one of the most curable disease. Like if it is very common in young adults, so we have to take care about their fertility. We have to advise them accordingly before starting treatment for to preserve their fertility. And they may go on to, since they go on to have actually 70 to 80% Hodgkin's lymphoma patient live very long and have a normal life. So they go on to have their normal life. They go on to have children in future. So we have to take care about their fertility. We advise them accordingly, and the necessary steps are taken. Similarly, so we always tell them the for Hodgkin's lymphoma, according to the stage, the treatment that is defined is varies from 4 to 6 months at the maximum. But they should complete the treatment because the relapse Hodgkin's lymphoma is not that good a disease. It can be cured, it can be taken care of, but it is not a good disease. So our first attempt to treat Hodgkin's lymphoma should be the best attempt and optimal attempt. So we tell them to somehow comply with the treatment, and it is not difficult. It is not difficult. Even the elderly patients, young adults are able to take most of the treatment in a smooth way. It is about the elderly patients we actually are worried, so whether they'll be able to complete their allotted schedule. Even they are able to do it if we give the treatment carefully, taking care of all the parameters and all. So it is a very, very treatable disease, and 4 to 6 months is an average span of treatment, whether chemotherapy or maybe few cycles of chemotherapy or radiotherapy. So the patient should undergo this treatment diligently, and after that should follow up diligently and there should be a long follow-up. It should not be Hodgkin's lymphoma should be followed up long. Rarely we have seen later lapses, but they are rare.
So what you're saying is patient compliance is very essential and they will do very well.
They will do very well. They
Yeah.
will do very well because the first thing we tell them is this is among the disease, if you choose, among the lymphomas, if you choose, Hodgkin's lymphoma is the one which is one of the most treatable disease.
Yeah. Okay. So when it comes to treatment, Dr. Dinesh, how do you decide what the course of treatment for the patient? Are there different regimens for different patients? How do you decide on the treatment aspect?
So, knowing where the disease is or at how many places it is, in other words, for a doctor, what is the stage of the disease? So there are three treatments of any cancer, including Hodgkin's lymphoma. The three treatments are basic treatments are chemotherapy, radiotherapy, and surgery. Hodgkin's lymphoma is a disease which is non-surgical. It is a disease spread everywhere. So generally surgery is out. So only two treatments remain, radiotherapy and chemotherapy. In very early disease, is just one lymph node involved, probably we may just go ahead with radiation and absolutely cure the patient. In disease which is slightly advanced, we may use radiation and chemotherapy both, or sometimes we will use only chemotherapy. So there are different protocols used based on how much is the load of the disease and where all the disease is. When we use chemotherapy, which is the commonest treatment, practically everybody gets, it's anti-cancer drugs clubbed together. They are given in certain schedule. So when we combine anti-cancer drugs together, it is known as a chemotherapy regimen. And every regimen has to be given in a certain frequency. For example, general regimen, the most common regimen which is used in Hodgkin's disease, is on an average given every 2 weeks. So patient comes today, he gets chemotherapy. Patient comes after 2 weeks, he gets chemotherapy, and so on. Again, based on the size, based on the locations, spread of the disease, the doctor would decide whether the patient needs only 2 cycles of chemotherapy, 4 cycles of chemotherapy, 6 cycles, or 8 cycles, or whatever it is. It may be up to 12 cycles of chemotherapy, and may decide whether to additionally add radiation or not. So basically, it is a treatment which is continuous, which should be followed rigorously, practically more or less on time, because it's a curable disease, and the regimen will be decided based on the patient's condition. Most importantly, the patient should remember is you have to follow strictly the regimen, whatever has been advised by your physician. Yes, chemotherapy regimens may have some side effects, some toxicity. So you may have to undergo certain investigations after chemotherapy, before and after chemo. The doctor will advise you. But on an average, the tolerance of chemotherapy is very good. Generally, patients do not have many problems. So, request to all our patients, stick to the regimen, continue with the advice of the physician. But remember one thing, these treatment schedules will be interrupted by investigations. So, for example, we feel that PET scan is one of the very important investigations before I start the treatment. And generally, after at least 2 course cycles of chemotherapy, it's required, it's mandated to repeat a PET scan to see how much your disease has responded. So decision it's a dynamic decision. It's a dynamic decision. It is not a fixed decision. The treatment regimens, the treatment schedules are dynamic. They are based on how the disease is behaving, how things are changing. So my request to patients, please follow the schedule, follow the physician's advice, and you should be sticking to your schedule. It's a curable disease. Treatment of cancer generally, in general, involves 3 departments: radiation, chemotherapy, and surgery. Because lymphoma is a generalized disease involving multiple places, surgery is not the solution. So surgery is out. So the treatments now remaining are radiation and chemotherapy. Generally, majority of the patients would require chemotherapy for the treatment. So chemotherapy is used by combining multiple drugs. When you combine drugs, this is known as a regimen of chemotherapy. A chemotherapy regimen is given in a fixed dose in a fixed time. So every regimen follows a certain schedule. The common regimen used in Hodgkin's lymphoma is generally given every 2 weeks. So that means a patient has to come to the hospital every 2 weeks. This treatment would involve blood reports just before starting every chemotherapy to see whether there are any side effects or not. So chemotherapy is the mainstay of Hodgkin's lymphoma. But if the stage is very small, or if some nodes are very big, we will use sometimes only radiation as a treatment, sometimes adding radiation to chemotherapy as a treatment. The whole idea is to completely kill the disease, or in medical terms, we call it achieving a complete response. This is possible to be done in Hodgkin's lymphoma. So my request to the patients would be follow the schedule, follow the guidelines given by the physician. But we have to remember one thing in treatment. This is a dynamic decision. So on day one, if a doctor starts with some dose of drugs or some chemotherapy regimen, this may change anytime during the course of treatment. So the number of treatment cycles may be required, maybe 2, 4, 6. A doctor will exactly tell you what he is planning. But generally, after every about 8 weeks of treatment, generally we say 2 cycles of treatment, we would repeat a PET scan, which was done before initiation of the treatment, because we want to know how the treatment has affected the disease. On an average, we expect a very good response even in first 2 cycles, literally more than 50% of disease suppression. Depending on the response, a doctor may take a call of adding some drug, removing some drug, or altogether changing the treatment. So decision of treatment of Hodgkin's disease is a dynamic decision to be changed based on the response patient gets after initiation of chemotherapy. So patient should be aware that if a doctor has said that you need 6 course cycles of treatment, that doesn't mean it's 6 cycles. He may change the treatment in between. So remember, dynamic decision needs to be reviewed in between treatment. But sticking to the regimen, sticking to the schedule definitely helps in cure of the disease. Thank you.
After being diagnosed with such a life-threatening disease and having to undergo these rigorous chemotherapy sessions, I'm sure it is quite taxing on the patient. Dr. Ajay, could you let us know how the patient can adapt to this new situation?
Right? This all situation depends on the stage of the disease. So as Dr. Pandakar already well illustrated the staging and all, I just on top of all this, because all the cases are might be relapse in future in the tune of different stages, different percentage in different stages. Like in stage 1 and 2, we usually give 2 to 4 cycles of standard protocol of AVVD followed by radiation. If we use 4 cycles, radiation can be avoided, but practically 2 cycles with radiation or 4 cycles of AVVD suffice in early stage breast cancer. So in early stage, Hodgkin lymphoma, the overall survival is in the tune of 85 to 95%. And in these cases, mostly the patient is cured. There is no long-term relapse in these cases. Only 5 to 15% cases are relapses. So in stage 1 and 2, we don't bother about the relapses because it's mostly cured. But in stage 3 and 4, we usually give 6 cycle of standard protocol every 15 days. And depending on the after 2 cycle PET-CT scan, doses can be de-escalate or escalate depending on the response after 2 cycle with the PET-CT scan. And in these stage 3 and stage 4, the relapses are common. And the overall survival in stage 3 and 4 is around 70%. So 30% will relapse due course of the time. And in 30% of these cases, the most common event is relapse within around 60% within 3 years. So most common pathologic condition in this stage 3, 4 is relapse, which occur already I said is 30% of the cases. Second is after 3 or 5 years, there is a long-term side effect of our chemotherapeutic agents. We are, I guess I am online. I guess we are audible.
Yes,
Yeah,
yes, sir. You're
you're
audible.
audible.
So depending on the stage, survival, and chemotherapeutic agent side effect is a major concern. For like in stage 3, 4, we have to see multiple times second malignancy in our long-term follow-up, neuropathy in long-term follow-up, autotoxicity in long-term follow-up, and as previous speakers said, this the fertility issue in the stage 3, 4 is important because most of the time patient underwent autologous stem cell transplant where we give high dose chemotherapy. So at that time, ovarian preservation or sperm preservation is important at this point of time. So fertility issues, long-term neuropathy, secondary malignancy, and relapses. These 4 or 5 things are major concern in follow-up cases of Hodgkin's lymphoma, and these all events on the basis of only stage of the disease. If stage 1, 2, there is no chances of there's a relatively less chances of relapses, and because we tailored our treatment to cycles, there is no much long-term side effect. But in stage 3, 4, definitely yes, relapses and long-term side effect, including I said already 4 or 5 causes.
Okay. Okay, thank you. Thank you for that elaborate answer, Dr. Ajay. So, since this disease affects the younger population, I'm sure they would be very concerned about their sexual health and fertility. So, Dr. Jatin, could you let us know how do you handle the anxiety of these patients who come to you with these questions, and how do you what are the suggestions that you give to them?
For a younger patient, even if he's or she is early stage Hodgkin's disease, though in early stage the chemotherapy used hardly leads to long-term fertility issues, but radiation may cause fertility issues. So, but to be on the safer side, we tell them that you can consult a fertility specialist and take necessary precautions, or in the form of hormone suppressing injections, or sperm or ovum preservation, whichever thing they opt for, and whichever is the best suited for that particular patient, according to his financial status, and according to what is the age of the patient, whether he or she would be having fertility issues in near future or late future. So depending on that, I mean, there are various methods by which fertility preservation happens, and this has become quite cheaper these days. It used to be expensive, but now, these preservation of sperms and ovas, they have become pretty cheap these days. And we do advise them, because again, our main purpose is not only to cure the patient, but also to take care of his or her life in the future, especially the young adults. So the fertility thing is a big. Sometimes, we have seen some patients being diagnosed immediately after marriage. So, in those cases, where the family has not yet started, so we have to take care of these things very meticulously, and there would be at the max a delay of a week or 10 days before starting treatment, and that is acceptable for this thing, because again, as I said, it is one of the most curable things. So we should. I personally advise to each and every of my patients less than 30 years or so, maybe even more sometimes, who is not yet married and have in future want to get married and have children, to go to a IVF specialist or fertility specialist, and take the adequate advice and measures. We tell them about the extent of treatment we want to give, and we tell them about the requirement of the number of cycles, and we whether any kind of radiation, especially radiation near the lower abdomen. Suppose you have to give so testes, ovaries, which are there in the lower part of the body, so these things have to be told to the fertility specialist, and they can accordingly advise the methods.
So, Dr. Dinesh, considering your vast experience, I'm sure you would have treated many patients with Hodgkin's disease. Do you come across any specific communication barriers with your patients, and are there any facilitators in the various stages of the course of the disease that you would offer to the patients?
So yes, naturally, because they're all young people, there are challenges. The first challenge comes in accepting a diagnosis that I am suffering from cancer. The word cancer itself kills them. And these days they would come, they would have read something, or they would have informed by something, cancer means deadly disease. So the first and foremost thing which goes initially is counseling them that this is not a deadly disease, that this is a curable cancer. Naturally, when you say this first time to the patient, he feels that doctor is just letting me know this because he just wants to satisfy me. He just wants me to be happy, but this is not truth. It takes time for him to get into the idea, to get convinced that yes, this is curable. Yes, there are counselors who can sit with the patient. There are psychologists who can talk to the patient. I personally feel that this is my job as a physician to do. And I, fortunately, unfortunately, it's my personal philosophy that I keep in touch with the patient. I counsel the patient all the time. I talk to the patient all the time. Because if a physician speaks to the patient, it's always more convincing than anybody else talking to them. Yes, it requires more time from the physician, but then before you is a patient who is absolutely curable, patient who will be living very long, patient who will be practically living a normal life. I would rather spend time with him convincing or making him agree that this is a curable disease. Is it doable? Absolutely doable. Yes, it requires time. So my philosophy is physicians should personally convince the patient. Patients have more faith in a physician. They believe physician more than anybody else in the society. So naturally, physicians should do their job in convincing. Challenges are there. So this patient who is cured, he goes home, he's fine. After 3, 5, 7 years, when he has no cancer, one of his friends gets cancer for whatever reason, maybe any cancer. It's 100% that on this day, this child will come back to you. Saying that, is there any problem? Am I getting my disease again? Please check, I am normal. This kind of an anxiety is absolutely common. The moment they come in contact with any other cancer, the first thing they start thinking that my cancer is coming back, they will come for a review. When many times we have already said, please don't come to us, you are absolutely cleared. So these moments are very common. Anxiety is a very common thing. And unfortunately, they get treatment like Dr. Gogia said, the median age is 21 years. So on an average, every second patient being treated by you is around 21 years. This is an age which is really very, very, it's a young adult age, which is very troublesome. A lot of things in the brain are not mature. A lot of ideas are not mature. So psychologically, there is a challenge, but the only way to meet this challenge is proper communication with the patient, rather than proper multiple communication with the patient, and a reassurance at every stage of treatment. Things are doable, and believe it, patients get convinced and they do well. So Only thing needs to be convinced to the patient, curable disease, don't worry, you will be fine. And these are two statements make patients well. Thank you.
Dr. Ajay, would you like to tell us about what are the long-term side effects that these patients may have, either because of the disease or because of the treatment they have taken for the disease?
Usually, I already said in early stage, because we only use only 2 to 4 cycle of chemotherapy. There's no much. Yes, definitely immediate side effect is there, but there's no long-term side effect in early stage, except only long-term cardiotoxicity and long-term Raynaud phenomena. These two are the most long-term side effects. But in stage 3, 4, because we use multimodality treatment, sometimes radiation, there's a lot of secondary malignancy cases are seen in stage 3, 4 after the certain time period, after the span of 5 to 6 years. Like second malignancy, most common is either sarcomas or any solid malignancy or MDS. Second one is long-term cardiotoxicity and Raynaud phenomena in stage 3, 4 is frequency is slightly higher. Number 3 is peripheral neuropathy, and number 4, because of the recently we use most of the time a newer molecule, newer drug conjugate, brentuximab. Like brentuximab is a long-term side effect is peripheral neuropathy, and which long lasting for about years and 5 or 7 years. And number 4 is rarely autotoxicity. So mainly concerned with all this protocol, and all these toxicity depends on the which protocol we use. For example, we use BCOP, like after 2 cycle patient is not in remission, we shift to the BCOP protocol. Then definitely second malignancy and infertility is most common in these cases. So depends on the which protocol we used. ABVD is very safe. BCOP is slightly toxic related to gonadotoxicity and long-term side effect. Radiation is definitely long-term side effect depending on the which area get radiated. And number 4 is secondary malignancy in the terms of MDS and other solid malignancy is a concern. And the most fearing is in stage 3, 4 relapses. So we tend to scans every yearly till 3 years in a higher stage to detect relapses in early phase, so we can modify our treatment protocol according to that schedule. Because once relapses within 3 years, the ultimately goes is again cured with high dose chemotherapy and autologous bone marrow transplant.
So, Dr. Jatin, could you tell the audience if there are any steps that they need to take to lower the risk of the disease to progress further or even coming back or a relapse? What are the steps that they need to follow once diagnosed and once they're on treatment?
First and foremost, once diagnosed, please be compliant to the treatment. We have faith on your doctor and follow his instructions thoroughly. Keep a healthy diet, save themselves from the infections by having a during the treatment, especially take a freshly cooked meal, home cooked meal as far as possible. Keep themselves well hydrated. And there are certain drugs which we give along with chemotherapy, and they have to take those drugs. Not much of supplements, but whatever things to prevent the side effects we give should be taken diligently, and they should report any symptom immediately to their practitioner, which will help them to comply with the treatment or comply with the cycles. We usually don't delay the cycles beyond 15 days. If the cycle tenure is 15 days, it is always better to stick to that 15-day schedule to have the optimal results. Go for PET CT scan as advised. First scan, interim evaluation is done after 2 months, And then after 4 months, that is after 4 cycles, I would say, in which patient has taken chemotherapy 4 times, or sorry, 8 times, but it is 4 cycles. So because you tend to escalate or de-escalate the treatment depending on the response to the treatment ongoing. So one thing is that. After that comes keeping this or maintaining this healthy lifestyle on follow-up, and also be regular on the follow-up as and when required, especially for the first 3 years, as my fellow colleague has told. It should be a very, very regular follow-up, and we usually don't do PET scans very frequently on follow-ups unless and until patient shows some kind of a symptom. But as and when required, if your clinicians feel you should go for a PET scan. Otherwise, we clinically and we also do certain blood tests to assess the patient. They can also report any long-term complications of treatment if they're having any which are persisting, as like peripheral neuropathies and all. So we just want the patients to know, or we just want to assure them that these are all temporary side effects. They will go with time. And I've seen most of the people after 3 years or so tend to lead a normal life, though that as Pendarkar sir told, that kind of nagging anxiety sometimes crops up in the brain of the patient whenever they see some other case of cancer. But again, that is good for the patient. They come for the follow-up. Then comes, suppose the patient has relapsed. So there's nothing much to worry in that case also, because salvage of the relapse cases in Hodgkin's is also pretty good. There are good drugs these days, and a person can go for a autologous bone marrow transplant if he or she responds to the next line treatment. There are very few primary refractory Hodgkin's cases which are actually bad cases, but there are now drugs available even for those bad cases. There is nothing as such other than this, except for a healthy lifestyle and compliance with the treatment and follow-up, which a patient can do to prevent this disease from coming back. So this is all I would suggest them.
Can I say one thing in the last?
Yes, doctor, please.
Because we have seen so much of cases, so most of the time, around 30% of the cases are usually present with the previous history of taken treatment of tuberculosis. So in India, it's very common tuberculosis. So this tuberculosis treatment might hamper the disease, natural history of disease, and patient come late because of the take treatment for tuberculosis, and approximately 6 month delay in the diagnosis and taking treatment. So in India, is very common practice for cervical lymph node, evaluation of cervical lymph node. Most of the time received anti-tubercular treatment in periphery, and that's why most of the time they are delayed in presentation. So it is very important to diagnose earliest as possible with biopsy. That's it.
Thank you. Dr.
So
Dinesh, would you like to say
I
something?
would like to add something very important. So we spoke of chemotherapy and radiotherapy. So cancer is an ongoing research and an ongoing science. There have been 3 very new developments in Hodgkin's treatment, which are extremely important for all of us to know. One is there is a new class of drugs called immunotherapy, which has evolved. and it plays a very important role in the management of Hodgkin's lymphoma. So instead of chemotherapy and all, we can use other drugs like immunotherapy. There is another drug available, new drug available for the management of lymphoma. New class of drugs, molecular, we call them antibodies like brentuximab. These are also available for the management of lymphoma. And there is something called high-dose chemotherapy with autologous stem cell transplantation. In common words, bone marrow transplantation. So these all options are available for Hodgkin's disease. So even they can be offered initially to the patient in an advanced stage, or they can be offered when the disease comes back. Disease coming back is today, we do not consider it as a challenge because we know how to meet this challenge. So for my message is, if it's an advanced disease initially, or if the disease for whatever reason has come back, do not be afraid. There are already new options available being routinely used by all of us. And at the same time, the research is on, and one must be really very sure that tomorrow I will have a next edition. So don't be afraid, take treatment, and please continue with the treatment. Don't be afraid of the future. Thank you.
So thank you, doctors. That was such invaluable information shared, and I'm sure the audience found it very illuminating. So all in all, if we have to summarize, Hodgkin's disease is one of the safest cancers to get. If at all anybody has to get a cancer, they would prefer to have Hodgkin's. And treatment, the early detection is very important. They need to reach out to the healthcare provider for early diagnosis. Effective therapies are available, and they do pretty well if they are very compliant with the treatment. And all in all, they have to have a positive outlook, maintain a healthy lifestyle to overcome this disease. They need not worry about being labeled as having a blood cancer, and if it is Hodgkin's disease, they can be rest assured they can have a normal lifestyle going forward if they are compliant. Thank you so much, Dr. Dinesh, Dr. Jatin, and Dr. Ajay for sparing your valuable time and participating in the endeavor of ET Health World to spread awareness of Hodgkin's disease. Thank you so much.
Thank you very much.